Professor Rob Warren has published over 200 peer-reviewed papers, published 13 book chapters, and has filed 6 patents. His research has challenged dogma and provided new insight into recurrent tuberculosis by emphasizing the important role that reinfection plays in driving the epidemic. His was the first to demonstrate the importance of mixed infection and its impact on diagnosis. Using molecular epidemiological methods, he conclusively demonstrated that the drug-resistant TB epidemic was driven by transmission. His work was the first to show that the XDR-TB epidemic was generated by programmatic selection of resistant isolates, culminating in the controversial classification of cases with totally drug-resistant TB. His pioneering work on mycobacterial pharmacogenetics has been recognized as an important determinant for guiding treatment. More recently, his research has provided novel insight into the use of substitute rifamycin in the treatment of XDR-TB with low-level rifampicin resistance. He developed a genotyping tool to identify members of the M. tuberculosis complex. The application of this methodology was crucial for the identification of BCG-osis cases in South Africa, as well as the identification of novel members of M. tuberculosis complex. Rob Warren was also responsible for the development of a transport bottle for the diagnosis of tuberculosis lymphadenitis, which has now been adapted for the diagnosis of TB using the expert MTB-RIF assay. His research has highlighted the importance of efflux and its role in regulating the intracellular concentration of anti-TB drugs. He jointly established the whole genome sequence analysis platform and is currently using omics approaches to decipher the physiology of the pathogen Mycobacterium tuberculosis.